going on, everybody? I am G. De La Merced here, and I am here to talk about your chapter 53 of your Pharmacology, which is the introductions to your respiratory system. What are the responsibilities of the respiratory system? The responsibilities are our breathing, our blood regulation, our blood pH regulation, our sense of smell, and most of all, our gas exchange. So there are two divisions to this, which is the upper respiratory tract and the lower respiratory tract. The upper respiratory tract is responsible for the movement of air in and out of our body. It usually moves to our body from our nose or mouth, but let's be honest, it's the nose, right? So it goes through our cilia, which then filters out the air if it is unclean, and it can also protect us from harm. And that's how the air goes through our nose, and then it goes through our pharynx, which is a muscular tube that connects the nasal and oral cavity into the larynx and esophagus. There are three parts to this, which is the naso, oral, and laryngopharynx. So after that, the air goes through our larynx, which contains all the vocal cords, and the epiglottis, which closes during the swallowing reflex, and to protect the lower respiratory tract from any foreign particles. This is also commonly called the voice box. There are three main functions to this larynx, which is the maintenance of airway, protection of the airway from swallowing, and also produces the voice. So after that, the air goes through our trachea, which is the main conducting airway into the lungs, and it also divides into two main bronchi, which further then divides into two smaller and smaller branches. All of these tubes contain mucus-producing goblet cells and cilia to entrap any particles that may have escaped the upper protective mechanisms. This cilia then moves the mucus up to the trachea and into the throat, where again it is swallowed. Inside this trachea, we have mast cells. Mast cells are abundant and releases histamine, serotonin, adenosine, and triphosphates and other chemicals to ensure the rapid intense inflammatory reaction to any cell injury. So there are two results when this happens. When these mast cells are irritated, which is the coughing and sneezing. The coughing causes air to be pushed through the brachial tree under tremendous pressure, cleaning out any foreign irritant. Then the sneezing forces foreign materials directly out of the system, opening it to a more efficient flow of gas. So after that, the air goes through our lower respiratory tract, which is the second part of our division. The lower respiratory tract is composed of brachial tree, the smallest brachials, and the alveoli. So the brachial tube or tree is composed of three layers, which is the cartilage, the muscle, and epithelial cells. In this cartilages, it branches down to the smallest brachial, which then holds the alveoli. The alveoli at the end of the brachials form the respiratory membrane, which these structures are the functional units of the lungs, where gas exchange occurs. So before we tackle onto the gas exchange, we first tackle onto the lungs. Lungs are two spongy organs that fill the chest cavity, which then are separated by the mediastinum, which contain the heart, the esophagus, the thymus gland, and various blood vessels and nerves. They are made up of brachial tree, the alveoli, and the blood supply to the lungs, and the blood coming from the right ventricle to the alveoli for gas exchange, and elastic tissues, which is important in allowing the expansion and recoil of the lungs to allow ventilation. The lung tissues receive the blood supply from the brachial artery, which branches directly off the aorta. The alveoli receives unoxygenated blood from the right ventricle via the pulmonary artery, which is then delivered to the blood of the alveoli, which is referred to the pulmonary perfusion. So we discussed earlier the gas exchange. Gas exchange is the process wherein we take in oxygen and then releases carbon dioxide. This occurs as part of the respiration, allowing an organism to exchange waste gases from gases to its needs in order to function. In the case for humans and other mammals, this allows for the expression of carbon dioxide and the intake of oxygen. Gas exchange then takes place along the respiratory membrane, which is the lining of the lungs in animals, and the circulatory system of the organisms, allowing the gas to move throughout the body. In unicellular animals, gas exchange allows gases to move freely directly in and out of the cell. In plants, the leaves serves as their lungs, so to speak. So after that, we have respiration. But before I tackle respiration, maybe I should first make a clear view of how the airway goes. So first, the air goes to our mouth or nose, then goes to our pharynx, then our larynx, and then the trachea, which is the windpipe, and then goes down to the left and right bronchus and bronchioles, and then alveoli. So, as I said earlier, respiration is an act of breathing to allow gas exchange, which is then controlled by the central nervous system. The inspiratory muscles are stimulated to the contact by the respiratory center in the medulla. The medulla receives input from the chemoreceptors to increase the rate and or depth of respiration to maintain homeostasis in the body. Alright, we're already at the halftime show wherein we talk about pathophysiology. What is pathophysiology? These are several conditions and disorders that may occur to any system in the body. So then, for the respiratory tract, there are four divisions to this: the upper respiratory tract, the lower respiratory tract, and acute and chronic obstructive pulmonary diseases. So the upper respiratory tract tackles about diseases, or in most cases, are the common conditions that affect the upper respiratory tract involving inflammatory response and its effects on the mucosal layer of the conducting airway. The lower respiratory tract are diseases that have been responsible for many centuries of respiratory deaths. And then there's the chronic, which is the permanent, and acute, which is temporary chronic obstruction of the airway, often related to cigarette smoking. For the upper respiratory tract, we tackle on common colds. So common colds are viruses that invade the tissues of the upper respiratory tract, initiating the release of histamine and prostaglandin, which cause an inflammatory response. Then there's seasonal rhinitis, which is commonly called hay fever, which this condition occurs when the upper airway responds to a specific antigen with a vigorous inflammatory response, resulting again in nasal congestion, sneezing, stiffness, and watery eyes. We also have sinusitis, which occurs when the epithelial lining of the sinus cavities become inflamed. And then there's pharyngitis and laryngitis. Pharyngitis and laryngitis are infections of the pharynx and the larynx, respectively, which are infections that are frequently caused by the common bacteria or viruses. And then we go on to the lower respiratory tract. First disorder of this is the atelectasis. Atelectasis is the total collapse of a once expanded alveoli, which can occur as a result of outside pressure against the alveoli. For example, let's say pulmonary tumor. For other references, you can go to Google or read your book at your own risk, of course. And then we go to pneumonia. Pneumonia is an inflammation of the lungs caused either by bacteria or viral invasion of tissues or by aspiration of foreign substances. In the lower respiratory tract, of course, patients complain of difficulty of breathing and fatigue, which can be understandable because of the lack of oxygen, and they are present with fever, noisy breath sounds, and poor oxygenation. Next, we go on to bronchitis. Acute bronchitis occurs when bacteria or viruses or foreign materials infect the inner layer of the bronchi. They are animated inflammatory reactions at the site of the infection, resulting in swelling, increased blood flow, and in the area that changes in capillary permeability, leading to the leakage of proteins in the area. The person with bronchitis may have a narrowed airway during the inflammation. This condition can be very serious in a person with obstructed or narrow airway. Next, we got bronchiectasis. Bronchiectasis is involved with the bronchi and bronchioles. It is characterized by dilation of the bronchial tree, and it is a chronic infection and inflammation of the brachial passages. With chronic inflammation, the brachial epithelial cells are replaced by fibrous scar tissues, which then is the loss of the protective mucus and ciliary movement of the epithelial cells. And then, if it is combined with dilation of the brachial tree, it can lead to chronic infection in the now unprotected lower area of the lung tissues. So, for now, we go on to acute obstructive pulmonary diseases. First of this is asthma, which is characterized by reversible bronchospasms, inflammation, and hyperactive airways. The hyperactivity is triggered by allergens or non-allergens, inhaled irritants, or by factors such as exercise and emotions. But let's not get emotional here. This is the trigger causes an immediate release of histamine, which results in bronchospasms in about 10 minutes. Okay, we're going to tackle on to the chronic obstructive pulmonary diseases, which is the first is cystic fibrosis. Cystic fibrosis is a hereditary disease involving the exocrine glands of the respiratory system, the gastrointestinal and reproductive tracts. This results in the accumulation of copious amounts of very thick secretions in the lungs. And then for the final, this is the respiratory disease syndrome. Respiratory disease syndrome is caused by obstruction at the alveolar level. It is frequently seen in the premature infants who are delivered before their lungs are fully developed. And while surfactant levels are still very low, surfactant is necessary for lowering the surface tension in the alveoli so that they can stay open to allow the flow of gases. And if the surfactant levels are low, the alveoli do not expand and cannot receive air, leading to decreased gas exchange, lower oxygen levels, and generalized distress, which from the type name itself, respiratory distress syndrome, it goes throughout the body as cells do not receive the oxygen that they need to survive. So that's it. Thank you for listening to my awesome presentation, and I hope you learned something today. Good day and good night.